Today, I'm honored to co-present with Linda and Ronnie from Concierge Home Care, and you will hear from both of them shortly. Providing more flexibility will be more important as the demand for physical therapy increases with the aging of baby boomers. The increasing aging population, along with the rise in chronic conditions, has placed a great burden of care on home health agencies. Many home health agencies do not have condition-specific specialists on staff and are readily available for in-home patient visits. Therapy visits, whether physical, occupational, and/or speech language pathology, are typically seen as a revenue driver for agencies due to the number of patients prescribed. However, agents which have been heavy or overprescribers of therapy are now disinclined to focus on therapy given what is happening with the PDGM model.
So within PDGM, we are really trying to figure out how we get the best outcomes most efficiently and with less resources. So really it's our solution, because I don't believe that less touches on our patients are the answer. We actually need more touches, and this gives me the ability to implement a mixture of virtual visits with in-person visits. So we're actually touching the patients more, but in a more cost-effective approach to that care. And it just really ensures that we're following through on our goals and our progress to those goals, and making sure that that patient is getting the care that really makes a difference. And how we can do that affordably, I don't know how anybody can do it without a virtual platform.
A little about what telehealth and virtual care is. It's currently on trend, has reported in the media, has reported by the government, and what you're seeing from your patients day in and day out is that consumers are expecting, demanding, and actually appreciating the value of virtual care. And virtual care takes a variety of ways. The modalities include any kind of transmission over a smartphone, a laptop, or a tablet, virtual visits, secure messaging, as well as condition-specific communications. All of these together help your patients stay on track with their treatment, as well as engaged in their own role in self-care in between in-person visits. Now, PDGM has really impacted what agencies have been working with at the beginning of 2020. And if we look at an agency like Concierge Home Care, they were actually innovative and forward-thinking in looking at virtual care and telehealth very early on, realizing that this is something that could help them with PDGM. And then a little bit later, Linda will also talk about how it helps them with coronavirus. I will turn this over to Linda now to talk about how Concierge is addressing PDGM with virtual care and telehealth.
Even from a therapy perspective on what we could do for patients virtually. And I think the first time it really came to light for us is we were sitting and we were meeting with an orthopedic physician that was working on a special bundle, and they were trying to figure out, how do I care for patients most effectively, and especially with less costs. And they were getting ready to sign a contract with a company out of California that was going to be completely virtual care via their therapists. And immediately I was like, wow, we're doing virtual care with our nursing team. This is a great opportunity for us to expand with therapy. And without giving away much of that secret, and because Ronnie's going to speak to it as we progress throughout this presentation today, again, I was pleasantly surprised at the effect that we could have to get better outcomes with less costs. You know, it really just meets our mission statement at Concierge Home Care has always been, we care for people who care for people. And I moved away from do the right thing by your patient, which obviously is very, very important, but really do the right thing by your team member. And adding virtual care for our team members has been a great opportunity, one for them to, to stay home and do visits from home one day.
The simple piece with PDGM, and actually, since 2011, since the Affordable Care Act came through, we just have to figure out how to sustain or get better outcomes with less. You know, there's just not the ability to provide the, I don't want to say amount of care, but the amount of care that we're providing has to be more effective and has to be more efficient. And Cindy allows that.
During COVID-19, obviously, we recognize that patients are observing social distancing, and physical therapists are using telehealth to help patients continue their therapy so that they do not lose the momentum of their recovery amid the pandemic. Now, patients who have or had COVID-19 may have a lot of fatigue, a lot of weakness, a loss of function. They cannot do things that they could do before, potentially. They have a lot of respiratory problems and loss of endurance. And because of potential comorbidities, some of their issues are exacerbated. So if you have a person with a previous fall injury, their balance could be affected even more so. For a patient recovering from any critical illness, not just COVID-19, rehab is vital as they work to regain the ability to perform the activities of daily living. Therapy provided in the home setting allows therapists to better compensate for patients' barriers to recovery. And telehealth is another way to continue patients on their path to a better quality of life and improved function and mobility.
So Cindy to Concierge Home Care is really a communications platform. So one of the neat things that we're able to do is push monthly educational messaging. And even as everyone knows, this past week we had a hurricane, so we were immediately able to send out messages via text to every single patient that we have on service with us right now, and just in the preparation for that, as well as giving out daily educational advice and where they needed to go and how to contact us and do all those pieces. We're actually able to even touch any patients that we've had. So on an average, we are admitting anywhere from 10 to 12,000 patients on a yearly basis. And at any moment, I can send out a push text message that hits all 10,000 of those patients and even some of their loved ones if I have their telephones in our systems.
All of a sudden we have a hurricane. And so we said, okay, well, how are we going to get, information to all of these patients rapidly? Where, again, old home care, we would all be picking up the phone, calling our patients saying, did you get your medications? We're able to send a mass message out to anyone who has that smartphone or text receiving capabilities. And we're able to touch thousands of patients within a 3 to 4 minute time frame versus 4 or 5 hours of picking up the phone, calling. The manpower that saved was huge for us.
So it's a wonderful way to brand and communicate. We actually also set up protocols that go along with all of our educational processes. So we're able to tie the education that my nurses are doing in the home on a daily basis and reinforce that and push videos to our patients to reinforce the education that they're receiving. So imagine back in March as COVID-19 started to hit, how instrumental having that ability and capability to push message and warnings and education about what was going on through COVID-19. It was just something I never thought we would need, but it was a wonderful asset to the care that we were able to provide. I think everyone was touched during the months of March and April as fear kind of transcended all of our patients that we care for, as well as our clinicians. And having the ability to say to a new patient that you knew desperately needed your services, but they were very fearful of even healthcare workers coming into their home. So having the ability to say, I'll tell you what, we can do some virtual visits to get started, develop a trusting relationship with that patient, and then be able to get in the home and care for the patient the way they needed. Teach them about the type of PPE and what we do to prevent spread of anything and in order to care for that patient.
They get stressed about bringing a nurse or a physical therapist into the home, and they'll refuse our visits. Where virtually they're much more open to allowing that nurse and allowing that therapist into their lives, and you get to develop that relationship that opens the door for them to be more engaged and accomplish the goals that they really want to accomplish. That's what new home care is all about.
With Cindy, we were able to accomplish that. We were also able to incorporate immediately our virtual visits into our therapy disciplines. And even we, for us, virtual care, as we have implemented over the last, year and a half to 2 years, has just become part of our care planning. So every patient that we see, it's not an option on how we're going to do virtual care. It's part of the care planning that we do with that patient and throughout that period. And they see it as an added benefit and touch point of how we accomplish the goals that we set with those patients from day one.
To give that patient an experience, an opportunity to establish rapport with their clinical manager, that person that's overseeing the care for their case. And we do that right bedside. So we come in and we meet with a patient there at the hospital prior to discharge. We help them download the Cindy application. We do initial call right there so they can see who their clinical manager is. They can see who their dedicated virtual care nurse is. It's quite a unique experience, and you can imagine just yourself being in a hospital, a little bit uneasy about going home, already being able to talk to your clinical manager, having that face-to-face interaction, and then having that face-to-face interaction with a virtual nurse who when you go home is going to be there in front of that computer whenever you need her. Makes patients a lot comfortable about going home and a lot more willing to give us a call versus going to the emergency room.
Also, I was just going to say, we've been able to, I hate to give a little bit of a highlight, but I'm going to do it anyway. I will tell you, I think everyone that's been in home care, and we look over the years, I've been in home care longer than I'd like to admit, but we certainly all know how many visits it used to take us to accomplish the goals needed for a knee replacement. And I think there's lots of folks that are listening to us today and can remember when we did 18 to 20 therapy visits, and then we started to figure out how do we care for a patient and get the same kind of outcomes in 14 to 16 visits, and then down to 10 visits. And we all know, especially if you're involved in CCRJs, that we're currently now doing total knees in 6 visits with no nursing visits, just 6 therapy visits. I'm really proud to announce that Ronnie's been able to actually accomplish the same outcomes on patients with 3 in-person visits and 3 virtual visits.
The goal is to reduce those unnecessary rehospitalizations. In return, it's going to end up putting more money in our provider's pocket, in our own pockets. So to be able to go to a referral source, to a doctor, a facility, and to be able to offer them this additional layer of service, additional touch points, the opportunity to reduce some unnecessary rehospitalizations really does make us a stronger partner in the community.
So times are changing, and we all have to figure out how to have magical moments, and how do we accomplish the set goals and do that with less costs. And it's really what Triple AIM is about, and better patient outcomes and better patient satisfaction. And I think Cindy has helped us accomplish those goals.
It's amazing how many times you're sending a nurse out to drive an hour or an hour and a half to go see a patient, because a lot of our territory is very rural, and we're able to actually meet that patient's need immediately by using Cindy and that virtual visit platform, versus waiting the couple of hours that it's going to take to get a nurse out to see that patient, resolve the issue that's going on and reduce that rehospitalization. Frequently in the past, that patient wouldn't wait for that time and just go straight to the hospital. And this way, we're able to provide them immediate care and an immediate solution to their issues.
Just last week, we had a situation where we had a patient in a rural part of Okeechobee County that had some demands for speech therapy, and we were extremely fortunate to be able, they had gone through every agency that was licensed to service that territory and unable to get speech therapists out to service this patient. So really exciting that we were able to use our virtual platform to be able to meet the needs of this patient. So again, it's just another out with the old, and we would have never thought about that as an option. And we do some Part B under with our home care agency as well. So we also have been very fortunate that under the current waivers that we have, we're able to bill for some of those visits that we're doing under the Part B side of things. So, you know, again, I just mentioned we use virtual care across the board, you know, not just with our COVID-19 patients. You know, I would tell you we are doing approximately 1,300 to 1,500 virtual visits on a monthly basis now. So, a good 20 to 30% of those visits are now therapy visits. So in the past, where we saw it just primarily as nursing, we're seeing more and more virtual visits that are occurring with our therapists. And as our therapists are doing that, they are so surprised and pleasantly surprised at how well their outcomes on those patients are increasing with those virtual visits. And our virtual therapy teams are identifying things that our nurses are missing and what their therapists are missing when you are in the home. It's amazing when you sit and you're concentrating on that patient face to face without some of the distractions that do occur when you are doing an in-home visit, what you can uncover. Especially through med reconciliation and med management. It's amazing what we can identify. We every Monday actually do a therapy call where a lot of our managers will get on the call and we'll review what we had for the week. And every one of those calls, we are giving example after example after example of where we've prevented a rehospitalization that occurred over the weekend. We probably do more virtual visits on our weekends, on our Friday, Saturday, and Sundays than we do all week, just because we know that those are significant days where rehospitalization rates are higher when you look at some of your data. So for a lot of our bundled projects, we do tuck-in calls on Fridays and Saturdays and Sundays virtually to try to make sure that we are meeting the gaps of those patients that, you know, typically agencies are working Monday through Friday and do a lot more visits, and we can touch the patients. And likewise, even from our therapy team, it gives them that ability to ensure the patients are doing what they're needing to be doing during the week as we check on those patients, and that on the weekend they're following through with the care planning that we're doing to prevent them from falls, preventing them from making sure they're keeping up with whatever conditions they're supposed to be agreeing to or performing from their physician's orders.
Yeah, as far as therapy goes, you know, we've been pleasantly surprised at the reception that our therapists have had. You know, when we first rolled this out just over about a year and a half ago, you know, therapist responses were generally, hey, I'm a physical therapist. This is a physical job. How can I do this face to face, you know, without being in that patient's home? But we've really seen that our therapists have taken the education that they work so hard to get, and they've really used this as an opportunity to shine. Like Linda said, we've had therapists on calls with patients catching vital sign issues, blood sugar issues, wound care issues, you know, again, medication issues. These are all things that sometimes therapists will overlook, but at this virtual platform, you really sit down. It's kind of an intimate time to talk to them and see things that you might not have seen. And then again, we've prevented rehospitalization. So not only are our patients appreciative, but the referral sources are also appreciative that we're keeping these people out of the hospital by having these extra touch points with them.
It's motivation, and that's what a patient needs, is motivation. So again, I can't say anything more than 100%. For me, it worked very well.
I think we've also, you know, Linda mentioned the total hips and total knees. We don't just do this for these post-op orthopedic patients. You know, we use this for physical therapy, occupational therapy, and speech therapy. And while this really lends itself really well for those bump projects and those total joint replacements, we're able to, you know, contact these patients a lot quicker and get quicker results. But we can do this for every diagnosis that we have for therapy and every discipline across the board. So it's really been easy to roll out because there's so much ease of use across every discipline. We have had speech therapists who say that it's enhanced their quality. Occupational therapists who they work so hard in the home to do this functional training, but they're not sure if the next day these patients remembered, right? You might teach somebody how to get in and out of the bathtub the right way. Well, how'd that bath go the next day, right? So to follow up and to really re-educate, reinforce everything that we've done in the home, it's really been a game changer for us. I really think that not only the therapists love it, but the patients love it, the referral sources love it, and it's been a game changer for us across the board.
I can attest to that as well. I remember the first time our speech therapist who I've worked with for the last 20 years, and she called me on a Saturday afternoon. She was so ecstatic about her first virtual visit. She was like, I can't believe how good this is and how well it worked. So she still to this day does approximately 8 to 10 virtual visits on a weekly basis. And certain patients, apply more than others, but it's amazing what she can get accomplished. And as we all know, under PDGM, with the limited ability that we have sometimes to effectively have a margin when we care for our patients, it's just a great opportunity that I can still have the same amount of touch points with a patient as I did pre-PDGM, but more cost effectively.
I think we've also seen that our patients, we under PDGM, I think a big fear is that people are going to lose visits. They're not going to have that kind of touch point. And not only are we keeping the touch points that we need to keep, we're actually able to add almost this VIP service line, right? Where the patient has an instant contact to not only their nurses, but their therapists, and they can see them face-to-face, video-wise. All they have to do is press the button to open the app and press the button to call, and somebody's going to answer and be able to provide quality education for them or reinforcement to really get them what they need when they need it. So it's been awesome for everybody.
Having contact on a set was very rewarding. I didn't have to worry about anything, and I was able to talk to them in my PJs, didn't have to go out anywhere, and it just made me feel a lot better that I could enjoy my weekend, though that there was nothing really wrong with me. It was all just normal procedures happening to me.
I sit here when I talk about I think about different keys of success, because I will tell you, we've been implementing, we started virtual visits, I think, before most people were even thinking virtual care as an answer for PDGM. So we are extremely, extremely fortunate that we've worked through some of the keys to success, if you want to say. When I first thought we were going to do this, I thought everybody was going to be so excited, and I'd have champions all coming to the table going, oh, I want to do virtual care, I want to do virtual care. It definitely took a lot longer, and I had to kind of take a step back and think about how do we incorporate this. So listen, there is no question that Cindy and virtual care is the answer to the care we're providing. But the big questions are, and I think the key to success on whether you're successful or not is how you operationalize that and how you get your team to encompass and really understand and do some trial and error to figure out what works. So I initially threw it out there for all of my staff to be able to do, and without real process behind that. And then I found I needed to really put my clinical leaders in charge of this. And Ronnie, and I have an amazing nurse that I work with who is our clinical director, and we set this really under a project management process, and how do we incorporate it into everything that we do. So when we started to really have success is when we started to hire specific nurses and therapists that were on our virtual care team. So they're very trained and detailed into what is that magical moment for that visit. What is the visit? Our virtual visits last anywhere from 10 to 15 minutes. And there's really I hate to say, skill or use that, but there is an educational moment in that. There is a follow. There is a skill that we're providing in those virtual visits that we do. And one day I hope that, Medicare will see the value that we're bringing to the table from a home care perspective and allow us to bill for some of those.
Buy-in is key, not just from our clinicians, but also from the patients. And it does help when we have patient buy-in and our clinicians can see the outcomes. So implementing anything new brings a lot of challenges to any program that we are implementing. With Cincy, we found it a little easier because the ease of use. It's not complicated, it's very straightforward. So when we had patients who were really excited about what Cincy could do and how it would improve their care while they rehabilitated home, our clinicians naturally and very organically decided that this was a program they could buy into.
We are also now starting to see some of our commercial insurance companies realizing that there's value to these virtual visits, and we're finally getting some reimbursement on that aspect for that care that we're providing. But it really was, how do we incorporate this into everything that we do? How do we get not just our nurses out in the field and our clinical managers and our utilization team and everyone, even our referral sources, our sales team, to understand virtual care as part of who we are. One of the, I think there are some benefits in life for everything that we go through, and COVID-19 has certainly affected the way that we think about delivery of care, how we effectively think about how we manage the care of our patients. And I do think we've probably taken virtual care further in the last 3 months than we did in the last 10 years. So that's been exciting, because I think it's made folks open their mind as well as their thought process to how to make this more successful. And that just kind of drove us up. And you can see our curve as we started to incorporate virtual care, especially last August, getting prepared for PDGM. And our we kind of have this line that goes straight up this, but during COVID-19, we saw that even go further up. And we've seen everyone just, really envelop virtual care and how we do it. And it's just an extra set of eyes for us as we look at alternative payment models and partners that are looking at ways to provide better care in a more cost-effective way. It allows us to have better opportunities from a marketing perspective as well to those partners, and more discussions and real discussions about how we are a partner in trying to figure this out, and how do we figure out how to effectively care for patients more cost effectively.
What we're hearing is there's not just the physical benefit, but the emotional benefit. And as you could see, obviously amid COVID-19, there's plenty of patients who feel that using the Cincy virtual care or telehealth platform is making them happy, but it's also making their children, whether they're nearby family caregivers or remote family caregivers, it's making them happy because everyone is feeling that they're getting safer, more convenient care, especially as they're trying to restrict as many in-person visits as possible. So you can see a couple quotes such as here, which is, "This helps me still get my therapy and see my nurses without possible exposure." Someone else says, "I can't believe I can still exercise with you without someone even coming to the house all the time." And then the second from the top where it says, "I can still take care of me and make my children happy at the same time." So it's wonderful to see that there's that emotional and physical benefit for the patients as well as their family members too. And on the flip side, the clinicians, as both Ronnie and Linda have articulated, are very positive about this. In working with a regional player that's based in Texas, we heard from their clinicians that they looked at the fact that they had already implemented telehealth because of PDGM and before COVID-19 has really a proactive thing that they could readily bring to their patients, and that they were happy that their agency was thinking outside the box far enough in advance to have this already implemented when it definitely became something which was practically essential, if not yet critical, during COVID-19. And Ronnie had pointed out that what's very impactful about virtual visits is this idea where you can continue that care and that you don't have to wait to the next in-person visit, and you can eliminate or just try to at least, downplay any chance of the patient regressing, because you can check in with them and have them work on something on their own, whether it's you're sending them a message or you're doing a virtual visit with them and making sure they're on track before the next visit. And I think what's so important is this last quote on the page, which is really about the social determinants of health, right? That look of concern, almost desperation, disappears from the patient's faces when they log onto the virtual call. This is something that they're looking forward to. They're building a relationship with your agency and with your therapist. And the virtual check-ins really helps solidify that relationship. And as Ronnie pointed out, it's something that essentially makes them feel like they're getting VIP care from you that they couldn't get from any other agency which is out there that's not using telehealth today.
Spending a lot of time today talking about therapy and virtual care, but it also allows me the ability where, you know, we cover such a large area, but in my WONC, my wound care specialist nurse can actually virtually, you know, call in with the nurse at the bedside and make the recommendations and move on to patient's care right away. And that actually, the patient in the home is so excited because we're bringing that specialized wound care nurse straight into their home with our other nurse. It's been wonderful for us to even under some of these waivers now, when we go out to see a patient that can't get into their doctor's office, to bring that doctor into that patient's home when that patient may not have the capabilities to do that. We've also been able to do that with respiratory therapy with COPD patients or nutritionists in areas where we just couldn't afford it. You can't afford it under PDGM, but Cindy allows us the affordability to do that. I also think about, I was walking through one of our offices not too long ago, and we like to use Cindy, right, even as a welcome call that my clinical managers do with their patients. And I heard a patient calling in on the Cindy app to the clinical manager, and she was so excited because she had a wound on her foot and her wound was doing better, but she wanted to, here she is with her phone showing my clinical manager in the office, and you could hear her throughout the office talking on the computer. Look how good my leg looks, and I can't believe how much I love Kendra. She's done such a great job. And it was just exciting to see, one, my clinical manager had the ability to connect with that patient in a way that she was never able to do before, you know, because that visibility and seeing someone across the screen just it's so much more meaningful.
My patients have actually really enjoyed using Cincy. My patients need a lot of reassurance. Behavioral health patients in general, a lot of times need a lot of reassurance. You know, that 30 minutes a week isn't enough for them, especially if they have other comorbidities. So having Cincy really gives them peace of mind that if they do have an issue that they didn't get addressed during the 30-minute visit, they do have somebody available that they can talk through it, and instead of going to the ER, which is a lot of their first response is to go to the ER to get an immediate answer, but now they have us. Medication non-adherence is the #1 rehospitalization for behavioral health patients. So with the Cincy platform, I'm able to check in randomly to do those checkpoints. Hey, did you take your medications today? Is there a reason you're not taking them? Are you taking them at the same time? Those kind of questions that in a regular home health visit, we might not get those answers because they might just tell us what we want to hear. But with Cincy, I'm able to do those drop-ins and do those checkpoints and actually find out what the patient's actually doing in their home when I'm not there. We have a behavioral health cadence that we send out, reminding patients to take their meds on a daily basis, reminding them of coping skills. And we're actually working on doing more of that.
Linda, how would you define the culture that you've set up and that you've strengthened over the years at Concierge Home Care?
Well, since we established, and as I mentioned earlier, we're really still in our infancy as a company, at 4.5 years into this. But, our mission statement was, I started my life in home health always thinking you do the right thing by the patient and everything works out well. But as I started our own company, it has always been a servant leadership platform with people come first. And our motto is we take care of people taking care of people, because when you take care of those team members, they take good care of our patients. There's so many different values out there, but we try to live and incorporate our values into everything that we do on a day-to-day basis. So integrity and, having the courage to meet the demands of reality, caring, encouraging the heart in every aspect of what we do. Quality, and when we talk about quality, we're always challenging the process. How do we make it better? Service, and enabling others to act and be the best that they can be. And then innovation's a big one for us, and it's overcoming challenges. So we are early adapters to a lot of different innovations, and I think it is one of those pieces that sets us apart, as well as attracts like-minded team members that really want to be part of something that's bigger than themselves. And then, of course, our team comes first in meeting the needs of our people, and that way it allows them to meet the needs of our other team members. I sit here and I think about an example when I look at culture, and I always I've got a story that I think it brings to light when I talk about how we want to develop a team that digs deeper and looks for the real issues and how can we really make a difference in a person's life. And it always brings me back to a patient that we had been referred to us for occupational therapy because the family was having difficulty with him bathing and bathing with the patient. So my OT went in, and we've always believed in using some type of standardized tool. So of course we use the MOCA to determine the level of dementia for this patient, or confusion. And of course it showed severe dementia, but this patient was still able to read. So our OT, went in and started working with sequencing, which I'm sure a lot of folks on the phone are aware of, but was able to get this patient independent with brushing his teeth. When you use sequencing, you can laminate a piece of paper and say, get toothbrush, turn water on, wet toothbrush, put toothpaste on. But you can walk a patient that has some dementia, if they can still read, and allow them some functionability and give them the ability to do it for themselves. So she did this, and then she did the same thing with bathing, got the right little bench for him so he could get in and out, and had little laminated sheets in the bathroom so he could simply bathe himself. So we're at the end of the episode, and she's getting ready to discharge the patient, and she's asking him, did we meet all of his goals? And he still has his head kind of hung low, and he says, I'd really like to get to the boys. And first thing she's thinking, oh my gosh, what part of hygiene did I not cover? But when she further asked him, he wanted to get outside of the house, and three lots down, the older boys in his neighborhood would gravitate together, and they would play cards in this open lot. So we were able to get physical therapy back in there and built a ramp for him to help him get out of the house. And this proceeded for a couple more weeks. And then, of course, we go to discharge the patient, and this therapist does a repeat MOCA to see what level of improvement we've had. And I always ask everyone, what do you think it showed? And of course, everyone says improvement. Oh, there must have been improvement. Well, it showed zero dementia. It was all depression. And when you don't take the time to really understand the patient, and the typical agency would have just gone in there and put in some grab bars and shown a patient, and the family members how to bathe the patient. But sometimes just taking that extra time to really make the difference, that's what we try to do on a day in, day out basis.
When people are asking potentially, so what does it look like? What is the patient experience when it comes to virtual care and telehealth? This is just a quick snapshot into what a secure message could look like. Looking at condition management, that's an idea of, confirming what's going on, when's the next appointment, as well as checking in to see how a wound care is actually progressing. And then in the middle, that's an idea of the virtual visit. And the wonderful thing about the virtual visit is that it's not just two people talking to each other, visually seeing each other, and that your clinician is putting eyes on the patient without being there in person. There is multiple participants which can be involved. So it could be the remote family caregiver, perhaps the referring physician, another specialist, maybe even a medically certified interpreter, and a pharmacist. All of these people are members of the broader care team. They're not necessarily going to be included in every single virtual visit, but there's probably an opportunity to bring them in to further align everyone on the patient's progress, as well as the next steps in their care. Providers are safely continuing the delivery of valuable care while minimizing the risk of infection and transmission by using RPM to better monitor and manage patients. Assessments are a very timely tool. So in the case of COVID-19, assessments are actually being used by the agencies to push them out to their clinicians, as well as to push them out to their patients, to understand if they are at risk, if they think that there might be a chance they are unfortunately affected with COVID-19, so that they could understand what's next in terms of their care and who sees them, how they see them, where they see them, when they see them. But above COVID-19, assessments can be created and customized to really match your own clinical pathways or your referring physician's protocols. And this allows you to really get a snapshot into the patient's condition, what they're experiencing, how they're feeling. Can be customized, it's easy to do, it's very quick for the patients to do it on their smartphones, do it on their tablets or their laptop computers. And all of this information really feeds into reporting and dashboards that obviously serve up very valuable information, both at the patient level, at the condition level, as well as your overall census level. So you have a sense of how everyone is doing. If there's something that is flagged automatically that your staff needs to look into, perhaps there is an emerging condition or a situation where a timely intervention is necessary versus waiting until the next in-person or virtual checkpoint.
So utilizing virtual care has truly improved not just our rehospitalizations, but our outcome scores, not just for OASIS, but our patient satisfaction outcomes. We all know that patient satisfaction is key. If your patient is not happy, they're not going to have positive outcomes. It doesn't matter what we do, they have to be excited about the care they're providing. So our results have been phenomenal. We have had just patient excitement and clinician excitement, and that's so refreshing in a world of healthcare where, again, you're used to patients who they're irritated because they didn't feel like they got the care they needed in the previous setting. So it's nice to see that they're excited about their care.
The use of technology, specifically telehealth and virtual care, in physical therapy can increase referral sources, strengthen patient engagement, and improve overall outcomes. As the concierge team highlighted, it will be crucial for home health organizations to use these platforms to help deliver cost-contained, compassionate, critical care in a more timely manner. This concludes our presentation today. Thank you for your time and interest. Feel free to reach out with any questions or requests for a demo.